Welcome to this CBS News live chat. I'm Cali Carlin for CBSNews.com, here with CBS News Chief Medical Correspondent, Dr. Jon LaPook. Getting a little echo from my computer. Sorry if you can hear that.
That's okay. It's very webby.
It is.
Get the echo.
Very web. So we are here today to discuss where America stands on a variety of issues, and we thank you for joining us, whether you're joining us from our Ustream channel or from our Facebook application. We have multiple ways to join us. But Dr. LaPook, you've been taking a look at where America stands on Alzheimer's. Before we get to some viewer questions, can you give us the broad picture?
Yeah, well, Callie, this is an enormous problem in America. Right now, there are 5.3 million Americans with Alzheimer's, and that number is expected to possibly triple by 2050. And there's no cure right now. There's no cure, there's no effective treatment. So this is a huge problem. I mean, not only for the patients, right? For the patients, it robs them of their memory, it robs them of their thinking, but it also robs them of their dignity and eventually their life. I mean, the average lifespan of somebody with Alzheimer's is only 8 years. So it's a big deal. And tonight we're doing this major segment, Where America Stands on Alzheimer's, for which we traveled, the 7 seas to try to figure out what's the latest and greatest in the diagnosis, treatment, and even prevention of Alzheimer's. So we went down to New Orleans and we visited a family, 3 generations of women who have been absolutely devastated by this illness. And I don't want to give it away too much, but I mean, really, we show you up close and personal what is going on with them, and you get a sense. There was a moment with them where now the ringing has stopped, or the reverb has stopped. There was a moment that I will never forget where the 3 generations of women, the grandmother, 78, 55, and 31, they're sitting across from me at the kitchen table, and 2 of them have Alzheimer's disease. Okay, and they're grasping each other's hands under the table. They're holding on to each other for dear life. And it was really very, very emotional. So our viewers tonight are going to really get to see what it's like for caregivers to live with somebody who has Alzheimer's, huge issues there. And then we went up to Harvard and we spoke to some of the world's greatest researchers on Alzheimer's to see what is the latest about that. And we'll talk, I guess, during the broadcast about what that latest is. And finally, there was a little bit of a tease, which I'll tease everybody for tonight. I want everybody to tune in tonight. But what if I told you there's a place on this planet where people pretty much almost never get Alzheimer's?
You won't give it away now?
I ain't telling you now.
No,
you have to watch the CBS Evening News with Katie Couric at 6:30 tonight on Eastern Standard Time.
Well, my first question in relation to the family that you said you interviewed, 3 generations of women, because my grandparents, 2 of my grandparents had Alzheimer's. How much of a component are genetics in whether or not you'll get Alzheimer's? And then we're going to get to some viewer questions.
Okay, genetics are a component, okay, but here's the problem, or the issue. They may increase your odds of getting Alzheimer's if you have the most common genetic variant. You may increase your odds by, say, 3 times. But it's not a guarantee that you're going to get Alzheimer's. And so the issue is, do you want to know if there's no effective treatment? So, some people think this way, some people think the other way. So it's there are ethics.
But wouldn't you want to know for prevention? And that leads us to Gene Ryan's question, which is, what are the opportunities for prevention and reversal? Where do we stand right now in preventing it and reversing it?
The first question, right to the meat of, I think, the most exciting area of research today, which is prevention. And when we went up to Harvard, I discovered something that I did not know, which is that the current theory is that the changes that happen in the brain start about 10, 15 years before the symptoms of memory loss begin. So, of course, researchers immediately say, okay, how can we figure that out? Well, previously, you had to find the diagnosis of Alzheimer's at autopsy. We have to say what causes Alzheimer's, right? So the leading theory is that it's a sticky protein called amyloid, beta amyloid, and that gums up the brain and interferes with the synapses, the ability of the cells to communicate with each other, and it leads to memory loss, okay? Over time, that builds up. So if there's a way that we can pick up amyloid in somebody who's living and not have to wait till autopsy, wouldn't that be great? Because traditional CT scans, MRIs, they just look at the brain when it's late, when it's shrunken, and that really, by that time, it's too late. So there is a new test called a PET scan, okay? And the PET scan can stain amyloid in the brain of a living person. So you say, great, person has amyloid, we know they have Alzheimer's, right? No. Because recent studies show that about 30% of people over the age of 65 have amyloid in their brain and yet no memory problems. right? 30% of people over 65 who have no memory problems have amyloid. And the million-dollar question is, who among them is going to go on to get Alzheimer's? So Risa Sperling, who is a physician and a researcher up in Boston, is doing another test that's coupled with the PET scan called a functional MRI. Functional MRI is that traditional MRI of the brain, but it's actually looking to see how well the brain is working, actually functioning at this moment. So she's matching the two up, and she's saying, okay, she shows you a card and says, memorize this person's face. And we show this in the piece tonight, by the way. And then later on, she'll show that same card. And the memory areas in the hippocampus, certain memory areas of the brain, are supposed to light up on the functional MRI. And if they don't, then there's a problem with memory. And so by doing these sophisticated tests, you can pick up changes in the brain that happen, say, maybe 10, 15 years before the symptoms will begin. And now the million-dollar question is,
so once you determine that, can you actually prevent it from worsening?
And the reason why I had to go through that whole rigmarole is that we have a bunch of drugs right now that people have tried that sop up or destroy the beta amyloid in the brain, thinking, okay, fine, you have beta amyloid, that's the problem, just get rid of the beta amyloid and you'll think better, right? Well, wrong. Because the trials that have been out there have tried that, but mostly in people with fairly advanced disease. And the analogy that they gave me up at Harvard and Brigham was, it's like waiting for somebody with heart disease to have 5 heart attacks, and they're in heart failure, and then you say, hey, would you like this Lipitor? That'll help you. Well, it may help you a little bit, but it sure is not going to help you as much as it would have had you given it 10, 15 years later at the beginning. So they're thinking maybe these same drugs or other variants of drugs that get rid of amyloid or a related protein called tau, T-A-U, which are these tangles inside of cells that goof up communication and function of cells. Maybe if we start attacking them earlier, much earlier, before there are symptoms, that's really going to be the key to prevention. All right, and that's medication, right?
Right.
But America is a country where we like to say everything's in a pill, right? You know, you have high blood pressure, take a pill. You're depressed, take a pill. You have high blood pressure or cholesterol, take a pill. So
what are some lifestyle or nutritional things we can do to prevent it?
That's exactly where we're going now, to say, look, maybe we want to find the magic bullet, we want to find the great pill, but until then, let's look at lifestyle, and especially exercise and diet. There's a study that was absolutely compelling to me that was done up in Washington Heights out of Columbia over the summer, published, that looked at people, average age 77, elderly people, and they followed them for a number of years. I think it was about 14 years or so. Was the course of the whole study, and those people who followed a very strict Mediterranean diet and exercised a lot had about a 9% chance of Alzheimer's. That may sound high, right? But at 77%, it's actually a little bit on the low side of what you would expect. Those people who didn't...
It's 1 in 8 over 65.
Well, when you reach age 65, 1 in 8 people from that point on will eventually develop Alzheimer's. But by the time you get into your 70s, it's higher than that. It's probably in your 20s, maybe even a little bit higher than that percentage.
So 9% definitely is lower.
9% is low, right? So 9% in those people who exercised and had strict Mediterranean diet, and 21% in the people who didn't. Okay. Now, it wasn't a perfect study. It was an observational study. All of those caveats. However, it's interesting. Now, there is some lab evidence that if with rats, these mice that have been bred to develop Alzheimer's, they have amyloid in their brains, and you can actually put them on a treadmill up in Dennis Selko's lab. He went to Petco and got one of these exercise little things. You see these mice doing exercise and trying to keep them stimulated and having them in a stimulated environment, and they're looking to see whether the amyloid either goes away or whether somehow the exercise helps negate the effect of the amyloid. So, it's fair. And then the other thing is there's some evidence.
There's really not a lot.
Well, no, I wouldn't. And then there's evidence that exercise increases the function of the memory centers. Okay, so on functional MRI. Right. So for people out there right now who are saying, what should I do to prevent it? I would say diet and exercise certainly are something that are not going to hurt. There's this saying, what's good for the heart is good for the brain. Okay, and the risk factors for heart disease are really very similar to for dementia. So high blood pressure, high cholesterol, diabetes, obesity, especially central obesity, the big fat gut, and not exercising. So it's certainly not going to hurt to try to take care of some of these risk factors, and smoking.
Now, the other part of Jean's question, though, was reversal. Once someone has Alzheimer's, is there anything we can do to reverse it, or is it like hair loss? Once you lose the hair, it's gone?
Well, again, these studies, and there have been these trials, bapineuzumab, which is an antibody that sops up amyloid that's already there, kind of some mixed results. The final story isn't out there yet, but we haven't had great results with this in people. But again, for the stuff out of Risa Sperling's lab, maybe it's because we're waiting too late. I mean, if we treat these people with these medications that are trying to reverse the amyloid, but we're waiting till too late in the disease, it's too late. Let's try to get them earlier. So I think that's really going to be the hope for the future. And there is a big initiative, the ADNI study, the Alzheimer's diagnosis, neurological imaging. Alzheimer's disease neurological imaging. That's what it is. Just trying to make that up. But Alzheimer's disease neurological imaging. And what they're doing is throughout the country, they're doing PET scans and functional MRIs and blood and urine and even skin testing and spinal fluid testing on people who are normal and who have early Alzheimer's and late Alzheimer's to see maybe there's a test that we can do. Maybe there's a simple blood test that we can do as a screening test, like cholesterol, that says when you hit 50, you're going to take
another question from our chat room from DKK2 is, where do we stand on genetic testing?
All right, there are genetic testing. There's genetic testing we can do, and the ApoE4 is a variant that is associated with, say, about a 3 times increased chance of getting Alzheimer's, certain variants of it. But again, it doesn't guarantee that you're going to get it. There is a very rare, there's only maybe a very small number, less than 2%, a couple hundred, I think, even families of people who have a very strongly dominant genetic form of it, where if you get it, you have the 50-50, if you get the gene, you're going to get the disease. But that's really not very common at all. So for now, and the genetic forms, the ones that are highly genetic, where you get it, tend to be in people who are younger. Okay, so the question is, if you have a family member who got Alzheimer's and is in their 70s or 80s when they got, what's it really going to buy you to get genetic testing? Are you going to do something differently about it? Is it just going to be to make you? It's like when I have a patient come in and they have high cholesterol and they have high blood pressure, is there something I have to do to convince them to do exercise and diet, and or really should they just do it anyway? So, I mean, people out there should do diet and exercise. It's the only thing that we have right now. There's no medication we're going to give them that says, oh, look, you tested positive genetically, there's a 3 times increased chance. Here's the risk benefit. It's worth it for you to take this drug. We're not there yet. We don't have that drug, but we're hoping that we get there.
How far do you think we are away from having a drug?
Every time anybody's asked us, I ask them up there, and they say, we always say it's 5 years, and then it's another 5 years goes by, and it's very tricky because they thought that amyloid was the answer, but it looks like maybe and Dennis Selkoe believes it's the answer, but there may be something else. There may be some other factors involved, and people have tried all different types of approaches to this. Is it too much inflammation? So people have tried giving anti-inflammatories with mixed results. Are you missing certain nutrients? So there was a recent report a few days ago about giving a cocktail of various antioxidants and phospholipids,
I've even read yellow curry can help. Maybe.
And I think people swear by all this stuff, but nothing has been shown to really do the trick right now. So that's why we have to do much more research.
Now, to back it up, a question actually from the room from Tyrone is, where does the name Alzheimer's actually come from? Dr.
Alzheimer, who I think it's Alois. I don't know how that is pronounced.
Spelling got tweaked a little bit.
In 1906, there was a patient with Alzheimer's, a woman, I believe, and she had dementia, and I believe the diagnosis was made at autopsy, and they looked in her brain and they saw these neurofibrillary tangles and plaques, which are the hallmark of Alzheimer's disease. Those are the pathological changes that represent the amyloid and the tau deposition. And it got the name Alzheimer's disease, and it's stuck. And it was over 100 years ago, and we still don't have a cure.
Right. And we've seen the number of cases increase, and you said they're projected to increase 3 times by 2050. Why is it? Is it because people are living longer? Are we diagnosing it better? Why do you think we're seeing such an increase in cases?
I think it's basically that we're living longer, okay? 95% of people who have Alzheimer's are over the age of 65, right? So then the next logical question is, okay, what percentage of the American population is over the age of 65? 100 years ago, that was only 40%. So most people didn't live long enough to get Alzheimer's. Now, 90% of Americans live until 65. So there's a much greater chance of developing Alzheimer's. Now, at the same time that this is all happening, and we don't have a cure for Alzheimer's, we don't even have a treatment for it that's effective, we're doing better at other things. So deaths from strokes, deaths from heart attacks going down, deaths from Alzheimer's went up 50% in the last decade. So that is
So the deaths are up, plus it's the cost of care and the quality of life.
Right. One estimate I saw, I don't know how you make this estimate, but they estimated $20 trillion over the next 40 years. Medicare costs triple in somebody who has Alzheimer's, and the huge cost, not only financially, but emotionally to these people. I mean, you'll see in the segment tonight, it's just devastating emotionally to people, the caregivers. I was on the Alzheimer's message board, and in the last couple of days, alz.org, Alzheimer's Association, and they've been wonderfully helpful. And I've been answering one by one and listening to these stories that people write, and it's so poignant. Some of them, many of them have early Alzheimer's, and you see the little bit of change in their syntax, which is so moving, but they're still thinking. And in fact, today, this morning, I read a very impassionate blog by somebody, a message to me saying, please let people know it's not just a memory problem, it's a thinking problem. It's not just memory, it eventually affects your whole brain, and it's such a cruel disease, and what's such a cruel moment, and you see it in the women in Metairie, which is the suburb of New Orleans, is they're at that cruel stage where they can still understand what they're losing and what they've lost, but they and they can still also see the silhouette of what's yet to come. So they're still kind of with it. They're still with it.
To know that it's going to get worse.
And it's a cruel stage. And then, later on, they see other people who have gone to that other stage. And then the other problem, which I really want to do a segment about, is what about spouses? What are even the ethics behind that? It's for better or for worse, right? Okay, this
Absolutely.
is for worse. And
both of my grandparents got Alzheimer's. And in a way, we said it was almost a blessing that they both did, because they went through it together as husband and wife, which, as you said, if it's just one spouse, that can be even more challenging to watch one person's mental state capacity really deteriorate. So obviously, we understand the spectrum of the problem and the cost of it emotionally and financially. So why is it taking us so long to come across a cure? And is Alzheimer's receiving the same amount of funding for research as some of the similar diseases and illnesses?
Funding. There is a funding initiative now to try to get more funding for them. Of course, everybody always wants more funding.
I think
I'll tell you one of the real issues is, and I'm a physician, I'm a practicing physician, is that I don't think physicians are hip enough. I don't think we're well educated enough about dementia and the importance of picking it up early. I mean, in my practice, it's the biggest fear people have. They come in and they say, I think I'm losing my mind. I'll go, what happened? I was making a phone call, and I was dialing, and it was ringing. Somebody picked up. I had no idea who I was calling. Or I was in the middle of a sentence. I lost my train of thought. Or I saw somebody. I know this person like I know the back of my hand. I couldn't think of their name, okay? And people have said that to me, right? And of course, I've had that happen to me.
I have too.
a typical response is, oh, it's just normal aging. Don't worry about that. That happens to me too. Okay, now the truth is that much of the time it is going to just be normal aging. But what about if it's the earliest signs of dementia, okay? So I think doctors have to, it's a tricky tightrope to walk, right? You want to take the person seriously. You don't want to alarm them, but you do need to be able to learn how to do these simple mental status exams. There are mental status exams you can do in the office that are a screen, and then if the person doesn't do well on them, then refer them on to an expert in the field. There are medications, 5 of them that have been FDA approved, to treat the symptoms of Alzheimer's, okay? But they tend to, and they work, they can stabilize symptoms, but they tend to wear off after a while, maybe about a year or so, and they don't do anything to attack the underlying disease. That's what we need, Callie. We need to attack the underlying disease and get rid of that.
Right. In the meantime, we have a couple more questions from the chat room about causes. One from Seabow, do you think that there could be a link in mercury dental fillings in Alzheimer's? And then another question from MJ721 about aluminum.
I was going to say, and when the mercury question was out, I said that's always that goes with aluminum.
Exactly.
People have looked for that, okay, and it is not. There's no proof that is the cause of Alzheimer's, okay? Now, dementia is a very tricky thing, okay? First of all, there's confusion about dementia. Dementia is a big topic. There are lots of different causes of dementia. In adults, 60 to 80% are from Alzheimer's. But other causes are mini strokes that you don't know about. They're called vascular causes. There can be medication. You're over-medicated. I mean, once you get on more than 6 medicines, the odds of an interaction are pretty high. You can have low thyroid. There are lots of other things that can contribute. And the reason why I bring this up is that if the person does have a tendency, maybe you're that 30% of people over 65 who have amyloid. So you're starting to get some deposition, but you're still pretty okay. And by the way, people with higher education, it can be harder, trickier to pick up the changes because they do tend to do better on these simple tests, right? It's not that the education protects them, it's that they may fake out the people trying to figure out whether they have memory problems. You do these tests, and let's say they have the amyloid. Well, then what if on top of that you have some other toxin? Now, mercury and aluminum. I know aluminum people were worried, for antiperspirants. I was asked that this morning actually by somebody, and there really is no evidence that it causes Alzheimer's. But there may be other things in the environment that are playing a role that we don't understand that make it multifactorial. We love things to be simple in medicine. It's this. You have a sore throat, it's strep. I give you antibiotics, it's gone. And sometimes medicine, very often, it's not that simple.
Okay. Another question from C. Passan about gender. Does gender have anything to do with the likelihood of developing Alzheimer's?
I don't think so.
It's pretty equal between men and women?
I don't think so, but I will tell you this, though. To the extent that women live longer, you would see it
by nature.
You would see it that way, but I'm gonna beg off. I don't know the answer to that, but there do seem to be a lot of women when you go to these places who have Alzheimer's. But I believe it's not that it attacks them more, but I think more that women tend to survive men. I mean, it's the old Jackie Mason routine where he picks up the obituaries and it always says survived. At the end, it says survived by his wife. So women do tend to live longer.
Another question about treatment with drugs versus, as you said, lifestyle or exercise. What do you think, both or one or the other?
Do it all. I mean, I wouldn't want to roll the dice to say this is going to be the answer. And by the way, Adrian Ivinson, who's a PhD up at Harvard, is saying pretty much the same thing. He is doing fascinating stuff. He says, you know what? We hope, I pray that it's, well, I guess he didn't say pray, but he said, I hope, I don't want to say something he didn't say, I hope that all anti-amyloid drugs do the trick. But if they're not, we're going to be in a fix, he said that. So what he's doing is he's going through 150,000 chemicals. They're just out there, okay? And how can you go through them?
That's ambitious, 150,000?
Right, 150,000 chemicals, there's a library of them, okay? And what he does is scientists come to him and say, I think such and such a chemical might work for such and such a reason, because I think that it'll attack this pathway in Alzheimer's formation, right? So he goes through, so I want a drug that does this. So how does he find the drug? He tests all 150,000 of them by using robots. And the robots can do in 2 weeks what it would take a person a year. So he's doing this up at Harvard. And the idea is to get a pipeline of other drugs out there so that in case the anti-amyloid drugs don't work, we've got something to fall back on.
Just in case.
Yeah, so that's really, and so I think, that's the philosophy. Don't just rely on the fact that, well, maybe bapineuzumab or Remem, which is an anti-tangle drug, the anti-tau, or bapineuzumab, which is an antibody that stops up the amyloid, that's going to work. Instead, let's try to, cover all bases, look through the 150,000 chemicals,
throw as many lines in the water as we can.
Do the exercise and do the Mediterranean diet, I think. And then, if you watch tonight, you'll see where that place is.
That mystery place
is. And then maybe take a look at their lifestyle, which is being done right now. Looking at their lifestyle and saying, what in the world are they doing?
Now, how long have you been working on this story?
57 years I've been working on this story. Has been going on for a long time. It's become a real emotional thing for me. About 3 months since we started doing the research, we've done the huge deep dive on it. Amy Burkholder, who's my producer, and Katie Boyle, who's our senior producer in The Bowl. I mean, we've really been working about as hard as we've ever worked on any piece on it. And we've gone all over the place. And I think, it's an interesting thing emotionally for me because, of course, I have 3 different hats, right? I am the doctor, I am the correspondent, and then I'm a person. And And it's very important to try to, of course, as the journalist in me wants to say, emotionally a little detached. And it's
do you have any family connections or ties? Is this in your family?
It's not in my family, although my grandmother, my mother's mother, had dementia later in her life and never was diagnosed. I don't know if it was from strokes or what it was from. But we don't have a lot of it in our family. But you know, you cannot help but become emotionally attached. As I'm sitting across from these women, I'm looking them in the eye, and I feel their pain. I mean, I really do. I mean, at times it's hard to just not well up as they're saying. I said, "What are you afraid of?" "I'm afraid I'm getting there." "Where?" "To nothing, to becoming nothing." And then this moment, which is not in the piece, but I will tell you about where we talked to Shirley, who's 78 years old, and I say, "What's going on with your memory? You know, what kind of problems do you have?" She says, "Well, you know, my long-term memory is pretty good. I mean, I can remember things from my childhood, and that's pretty good." What was the question? And I wish we could have used that, but that just, oh my God, at that moment, I mean, it just said it all right there. I mean, that's the short-term memory that she just demonstrated for us. And you could go on and on about these moments. I had some very sweet moment in Cobble Hill in Brooklyn, which is a nursing home, and they try to keep them active mentally, physically, and they have this one woman, Sylvia, who is in her 90s, who they pointed out to me. They said, "We're going to interview her." So I watched her. They're in the circle, and they're singing, "You are my sunshine, my only sunshine," right? And she hadn't been talking much, but she knew the words to those. I think that's really interesting. So she came out of the circle. We were going to do a regular interview in a chair, and I said, "Come over here," and we went to the piano. She said, "I used to play piano." I said, "Let's sit down. Let's do a duet," because I play piano. And I started playing. I said, I started, "You are my sunshine," and she wasn't singing. I said, "You know the words?" And then she starts singing, "My only sunshine." It was so sweet. And then, but she's playing, so she had the long-term memory. She used to play piano. She's playing on the keys, and it's like a 5-year-old playing piano, just hitting random keys. "You make me happy," random note, random note, random note. What? And right there, it was all there. I mean, and she could still understand what was going on. She smiled at it. She finished, and she said, "That song makes me happy," or something like that. And yet, it was all there. I mean, discombobulated. And
so are they finding that the exercise in music is at least halting or pausing it from worsening?
There are some studies, and some of them out this week, that shows that, you know, doing exercise, lifestyle changes really make a difference. And of course, there are lots of companies out there right now that are saying, you know, we have this computer program, Nintendo, or the Wii, or these brain exercises, doing a crossword puzzle. You should stay socially active. There's even something I saw about being happy. That being happy can help prevent Alzheimer's. And I guess if you have Alzheimer's, maybe you're less happy. But anyway, it's, you know, the cause and effect is hard to always prove. But I think you just go after all of these things. You know, do the crossword puzzle, learn a new language. One thing we found that we didn't used to think was true is you can actually form new nerve cells in your brain when you're an adult. We used to say,
"How?"
How?
Quick answer, since we're out of time. How do you form new nerve cells?
The brain somehow figures out how to do the rewiring. And people who have had strokes have rewired their own brains. I mean, their brains have rewired themselves to make it so that people can have function, whereas before they didn't. It's remarkable. Whole other segment.
That's a whole nother chat.
So there's hope. You know what? Do I think there's going to be a cure? You better believe it, because I believe, you know, good things are going to happen. I'll bet my last nickel on, you know, how bright everybody is. And I think the only thing that's going to hold us back is if we don't have the resources. I hope that there's plenty of funding for all this. And for people out there who think that they may have dementia or they have a loved one who has dementia, they should definitely try to get them into clinical trials. On our website tonight, we're going to have a link to show you where to go to try to get into clinical trials. And in the meantime, my heart goes out to everybody, because it is a devastating disease.
Well, I absolutely hope that we find a cure soon, for selfish reasons, because I know we have it in my family, and selfish reasons for all the baby boomers like my parents. But thank you so much, Dr. LaPook. We look forward to the mystery city that will be revealed tonight on the CBS Evening News, as well as your entire piece. And all this month we'll be taking a look at where America stands. And once the piece is there on the broadcast, you can find all of them on cbsnews.com. Thanks for joining us in this chat. We hope you'll come back often to cbsnews.com.